Hello and welcome to our program. We are so fortunate to have the ETHS Medical Advisory Group joining us for an information session on the COVID-19 vaccine. My name is Takumi Iseda. I'm the Director of Communications here at ETHS, and I'd like to ask our advisory members to introduce themselves with Dr. Marcus Campbell, our Principal and Assistant Superintendent. Marcus.
Thank you, Takumi. And I'm not a medical doctor. I'm a principal. So hello, everyone. Welcome for joining us tonight. Marcus Campbell, Assistant Superintendent and Principal here at ETHS. And I'm just delighted that we would have our medical advisory group joining us this evening to answer some questions about vaccines and so many other things related to the topic. So thank you all for joining us. And thank you to our doctors for doing this for not just for ETHS, but for our community. You to our doctors for doing this for not just for ETHS, but for our community.
Hi there, this is Amy Crow. I'm a pediatrician and parent of two ETHS grads. Well, one's graduating this weekend. And I work at Evanston Hospital as a hospital doctor, as well as I'm the medical director at the Evanston High School School-Based Health Center. Some families might also know me because I used to work at Erie Family Health in Evanston.
And I am an obstetrician gynecologist at Northwestern University downtown. I am also a parent of a current junior at ETHS and a daughter who graduated in 2019. Their last name is Harder, so you may recognize my name from that. And I'm happy to help serve on the committee to answer questions related to concerns about future fertility and all.
David Soglin, I'm the Chief Medical Officer at Laura B.
Formed and just about the partnership in general.
Thanks, Takumi. Happy to do that. We formed our medical advisory group in thinking about how we could reopen safely during the hybrid. And I reached out to some friends, and it's Sharon Robinson, and Sharon reached out to a few friends, and we've been having regular meetings. And I thought that this time would only go for a short amount of, we have a set group, but there was so much to talk about. There's so much that's coming up and so much that we would wanted to know as an administrative team, so much our teachers want to know, our staff. And so they've been so kind to continue to guide us and to just discuss various items, testing, ventilation, you name it. We've had a lot of discussion. And so the purpose of the group is to continue to help us to have a safe operation here at ETHS. We're not public health officials, we're educators, we're not doctors, we're teachers, former teachers, and, counselors and social workers and all of that. And so, but we've been very appreciative of the guidance and the counsel, the information that we've been able to receive from our medical team here. And it's been a great partnership, and looks like it's ongoing.
Wonderful. Thank you so much. And, since there is a lot of work already underway as we plan for the next school year, Marcus, if you could also just recap just a little bit of the information that has been shared.
Eliminating semester exams, and and all of these things we're doing so that we can have a more humanizing experience after coming through a pandemic and so much racial trauma as well, and so much loss. It's just been a lot of loss. And thinking and prioritizing the social emotional health of our students and our staff, having fewer transitions in the day is really advantageous and necessary, removing the stress of semester exams and going deeper in our courses and our content and classrooms, which means that all of that time during the semester exams we're giving back to instruction and all of that. And as I said, eliminating the transitions, having a 9-period day, 42 minutes, just a lot. And I've been here for 20 years, and our days have always felt very, very fast and a lot. So slowing the day down, allowing our students to experience fewer transitions and to really go deeper into the content. And it gives the teachers an opportunity to engage social emotional learning, to engage so many things in community building that really will help make students and staff feel good about being back and getting back to a new normal. So as I said, this is really about prioritizing mental health, social emotional health, and actually just good teaching too, good instruction to be able to go deeper for bigger blocks of time. And so those are the big announcements, and you'll continue to hear from us regarding how we plan to open and all of that, and our procedures regarding COVID and all of the attendance, all of the things that matter and that's really top of mind for folks. We'll continue to communicate.
Awesome. Thank you so much for all of that context. I think it's really important for, as we move into these questions, for people to understand all of those big changes that are coming as well. So let's really just get into the basics and start with our questions. I think the first question that comes to mind is, really, how does the vaccine work?
I'll be happy to kick us off. First of all, I want to just emphasize, I'm sure you all are aware, but how exciting it is that we now have a vaccine for COVID that can be used in individuals 12 and older. So this has an enormous potential for positive impact on ETHS, because that means that every student, every faculty member at ETHS will have an opportunity to be vaccinated before the fall. And so we wanted to help provide some context for all of you about what the COVID vaccine means, what that means for your child and for yourselves, so that we can all move toward a sense of normalcy again. So to start off, I promise I'll keep it very basic. I'm not going to get into the weeds about how these particular vaccines are made, but it is important to know that there are basically two kind of buckets of vaccines when it comes to COVID. There's Pfizer and Moderna, and I will spend most of the time talking about those, and particularly Pfizer, because right now that's the only vaccine that is approved for 12 and up, and in fact is the only vaccine approved under the age of 18. All of the other vaccines are for 18 and older only at this time. And then there's Johnson & Johnson, or the AstraZeneca vaccine, which are more traditional vaccines, which are what we call viral vector vaccines, where a piece of the inactivated virus goes into a different type of virus and gets injected into the body and spikes an immune response. But let's talk about the Pfizer vaccine in particular. And that vaccine is what's called a messenger RNA vaccine. Messenger RNA is a special part of our genes that sends signals to our bodies to do certain things. They're very smart, very intelligent. And so they come into our bodies, they give our bodies a message, our bodies respond accordingly. And so this vaccine provides an messenger RNA that tells our body to produce what's called a spike protein, a special type of protein that basically is a tool to fight off COVID. So that if and when we are exposed to the actual virus, our body is ready to go. We already have the tools in place. We're ready to fight this virus off, which is why people who are vaccinated, by and large, do not get sick, or certainly are not hospitalized or do not die from COVID, because our body is prepared. I consider it a dress rehearsal. That's what I call it. When you get the vaccine, basically that's a dress rehearsal for your immune system, so that you are ready to go for the big show if you come into contact with the COVID vaccine. And the one thing that I want to make very clear about the messenger RNA portion that I spoke of in this vaccine is, as soon as it sends a signal, as soon as it does its job, it disintegrates. It goes away. It does not stay in our bodies at all. It's there for moments, and then it disintegrates. And we also have our own messenger RNA that runs through our bodies doing similar jobs all day long, sends signals to our bodies, and then disintegrates. So this isn't like a foreign object or anything that's going to alter your genetic code in any way. David, do you have anything to add? Anything I missed?
Yeah, I mean, first of all, I love the analogy of the dress rehearsal. So I think that's great. The only thing I would add, and it's not anything that you missed, is that as Dr. Robinson said, this is a piece of messenger RNA. It's not the virus, so you can't get COVID from the vaccine. Some vaccines are weakened or killed viruses. This is not. This is a piece of messenger RNA that teaches your body to build a protein that then causes that antibody reaction that Dr. Robinson was talking about. So I think that's all I would reiterate, is it cannot get incorporated into anyone's genetic code, and it's not a part of the virus. It's not the virus, so it cannot cause COVID. Those are the only things that I would add.
Great, thank you so much. So related to that, for parents who have children ages 12 and up, how do you think they should approach the conversation and the decision about whether their children should get vaccinated?
I would highly encourage parents who have any questions at all to reach out to your pediatrician or your primary care provider in order to ask all of your questions. We are more than ready to help talk you through this process and this decision making. I will tell you from my perspective, I am a general pediatrician in the Evanston area. I am going to be hard pressed to not recommend this vaccine to anyone. There's, very few people who should not get the vaccine. And those are only individuals who have a life-threatening reaction to one of the components of the vaccination, which there are very few. There are not a lot of ingredients in this vaccine at all. It's a tiny population. So by and large, I highly recommend it. I do want to say that. However, I think it's important to reach out to your healthcare provider that you trust and you have a relationship with to make sure that all your questions and concerns are addressed.
Thank you, Dr. Robinson. So again, related to that, what would you say to parents who say that teens don't get as sick as adults, so they don't necessarily want to get the vaccine for their teenagers? Why would it be important for that age group in particular to get vaccinated?
Well, I can think of a few reasons. One is that some do get sick. Some teenagers get very sick and some die. So it's hard to know. We are very fortunate that the numbers are low in this situation, but it's very hard to know who those kids will be. And so that's the first thing to think about. The second thing to think about is, what is our responsibility to protect each other? So you have others in your family unit that may or may not be more vulnerable than those teens to having a complicated situation with COVID, and in your friend group. So what about the babies in the house? What about the elderly in the family? What about those with pre-existing conditions in the home? And I would say the same as we approach going back to school, all of us together. What is our responsibility to each other in this situation to keep us all safe? Although it's an individual decision, the way it works is if we do it together. So yes, we are fortunate that adolescents get less sick, but yes, adolescents can play a big role in reducing the spread of the virus. Anybody else have anything they want to add to that? No.
Looks like it was a very thorough answer. I think Dr. Soglin already spoke to this about you can't get the coronavirus or COVID from the vaccine. Could you elaborate a little bit more on, does it protect teens or young people as well as it protects adults?
Right. So David, you go ahead.
So in the studies that Pfizer did before they got the authorization to include the 12 to 15-year-olds, the Pfizer COVID vaccine was 100% effective in the 12 to 15-year-olds, meaning that they had the two groups. One got placebo, one got a saline shot, one group got a saline shot, and one group got the vaccine. In the group that got the vaccine, no child got COVID. In the group that got the placebo, 18 kids out of 1,100 got COVID. So it was 100% effective. I think as we as we do populations, I don't think it's going to stay at 100%. But it's clearly a superb vaccine, and it's going to stay in the 90 to 95% range, just like it has for adults. And the kids actually had, the 12 to 15-year-olds actually had a stronger antibody response. Dr. Robinson was talking about the whole idea of the vaccine is to create antibodies. And the 12 to 15-year-olds actually had a stronger antibody response than even the 18 to 25-year-olds, let alone the older adults. So very, very effective in this age group.
Thank you so much. So very common question, especially as the vaccine opportunities opened up for 12 and up. What are the side effects of the vaccine?
So the side effects are basically the same as we've seen for the 16 and up. The most common side effect is a sore arm at the site of the injection. And the other common side effects are fatigue, muscle aches, sometimes some joint pain, a headache. Almost all of those happen in the first day or so after the vaccine and only last for a couple of days. They're short-lived. They're usually worse on the second vaccine than the first vaccine, but not always. And what I would say is I don't have any 12 to 15-year-olds, but I do have I do have 4 young adults, all vaccinated. 3 of them had mild sore arms, and my 4th one, unfortunately, had a headache, some muscle aches, a little bit of a fever, and was kind of fatigued for a couple of days. She is fine now and protected. So, all good. But basically, it's the same kind of side effects you've heard about for all the adults in the past. No other side effects have been found in that younger age group.
Thank you, Dr. Soglin. So that really thoroughly explains like the short-term, effects of getting the vaccine. What about the future risks? People have been asking about, risks such as infertility in the future. These are more long-term concerns. I would like to throw that out to the group as well.
I can answer that question. Hopefully my Wi-Fi connection is okay and you can hear me. So at this point, from the information that we have, and obviously some of this information is limited, right? We don't have long-term data on these vaccines. These mRNA vaccines have only really been looked at since last fall. But historically, vaccines do not have long-term effects on either female fertility or male fertility. And certainly there's no reason to think from the studies that have been done so far, and there's a number of studies that have already been done out of Israel, some studies out of Miami, Florida, and also a lot of ongoing studies right now that are looking at the effects of the vaccine on male fertility and on female fertility. And we have not seen any negative effects from that. There is, and this kind of speaks to what Dr. Soglin was talking about, after the second dose of the vaccine, about 16% of males in the 7,000 people that were enrolled in the study, and unfortunately they tried to include pregnant women because that's always an issue with limitations of studies on pregnancy, but about 20-something women did become pregnant in the study inadvertently, and there were no adverse events seen in those infants and in those pregnancies. And there's been a number of ongoing studies in those pregnancies as well, quite a few that have come out of Northwestern downtown, and we've not seen any adverse effects. So we have no concerns. And in fact, quite the opposite, in that we strongly, strongly recommend that people do get vaccinated if they're considering pregnancy, because we know it is protective to have the vaccine during pregnancy. And as far as males go, I've had quite a few patients who have young sons express concern about future fertility for them. And there's actually more of a concern with them getting the actual COVID infection in terms of the potential for infection to their reproductive organs and the potential for infertility problems related to the actual infection, and absolutely not from the vaccine.
That's very helpful information. Did anyone have anything to add to that? That sounded like a very thorough answer as well. Okay. So, given all of that context, and that was really helpful, What would you say to a family that's maybe taking the wait and see approach, like maybe not, getting the vaccine for their younger children right away? What is the approach or the advice around the wait and see perspective?
When I was provided the gift of being able to receive the COVID vaccine, this was very early. I actually was fortunate enough to receive the vaccine 2 days after it was released, after Pfizer was authorized. So I was one of the first people in the United States to receive this vaccine. And people would ask, and when the opportunity presented itself for my now 17-year-old to get the vaccine, we did everything we could to make sure that she got vaccinated as quickly as possible. My 14-year-old daughter has already gotten her first dose of her vaccine. We look forward to being a healthy and safe, fully vaccinated home. So I really, and I know what COVID can do. I know what COVID can do to individuals, unfortunately, and families and households and community, be at birthday parties, at football games, together again and in a safe manner is so important and so critical. So there's just no choice in my mind. It's 100% the vaccine for me.
Thank you so much for that very personal perspective. As a woman of color, I can really appreciate what you've said, and as a parent as well. I think the next question, that's on the horizon for folks is, what about the younger group? Like, we've seen the 16 and up, now the 12 and up. Can anyone speak to the 12 and under group about being vaccinated?
I can answer that. Both Moderna and Pfizer are currently conducting studies for children that are younger than 12 in both safety and efficacy. They're looking at the dose that's being used right now and also smaller doses for those children. The timeline for completion is probably early fall. And that'll be these initial studies for safety and how effective the vaccine is. And then it will go through the same process that the other vaccines that for other age groups have, that requiring FDA approval and then CDC recommendations. So we're probably looking at best estimates the fall for children less than 12.
Great. That sounds like very short time, but right around the corner, really. So that's great news. Thank you for sharing that. So we've shared a lot of information. You all have shared a lot of information in this session. Where can people, if people still have questions, which I think many people are still trying to make those decisions for their families, very very carefully, of course. So where could they go for more information if they need more?
I can answer that. There's a phenomenal website called healthychildren.org. And it's great. As a non-pediatrician, as an obstetrician gynecologist, I look to that website for advice for my own children and for my patients' children. And I find that it's very comprehensive, very up to date. And it helps to look at it even before I call and contact my own pediatrician with questions. In addition to that, there's certainly other various academic societies that have lots of information. The American College of OBGYN has specific information. The NIH has specific information. For those people who really want to get into the weeds and look at the various studies, you can go to the NIH site and look up PubMed and search just about anything, and you can see all of the detailed statistics you want. But I would say probably cdc.gov to start and healthychildren.org as the second one.
Great. Those sound like really wonderful resources. Does anyone have anything to add on that? That was a really robust list. That sounds great. So for those,
the only thing I would add is what Dr. Robinson started with, which is your children's pediatrician or family practitioner, because everybody in medicine has been immersed in this for a year, over a year now. And they can be a really reliable source of up-to-date information. So sometimes I absolutely agree that those websites are great websites, but sometimes they're hard to navigate or hard to interpret what this means for my life. And so I would just reiterate how Dr. Robinson started, which is, call your doctor and ask them as well.
And I would add, if you don't currently have a doctor or have a trusted doctor, we have this incredible resource at our high school. So we have a full medical clinic that we're partnered with North Shore. It's free. And you can call.
The aspect is really important. So we would like to hear about where can we get the vaccine in Evanston?
Right. What's so different now compared to the last few months is that now you can get a vaccine tomorrow. So it's for your child. So it's pretty exciting. And it's a different mentality than it was before. This currently it's May 18th, 2021, and this will change every week or month, but there are two big events this weekend coming up for vaccination in the city of Evanston, and one of them is at Evanston High School. You can walk in or call North Shore and make an appointment, as well as Erie Family Health, both in Evanston, as well as Amita. So we have all three here in town ready to vaccinate your 12-year-olds and up. And then there'll be another big event coming in June, early June, at Evanston High School to vaccinate more. So look forward to that on June 2nd. Anybody?
Schedule and your location, we encourage you to do so. They are all the same vaccine, don't worry. So whatever is most convenient for you.
Great, thank you. That is very reassuring. And of course, the events that are being held at the high school, that information is being shared out to the Evanston community and to our family. So please, look for that on the website, look for that in your email. We'll continue to make sure to share that information out. It's also on the calendar, the online calendar. I really want to thank everyone for all of your expertise and your advice tonight. It's been really a pleasure to hear from all of you. And I know everyone is just so extremely busy. So thank you so much for your time. And I just want to throw it back to Dr. Campbell. Again, we're getting ready to already start summer school soon and then get into the school year. So there's never a dull moment at ETHS. Are there any closing remarks that you would like to share with our viewers?
I'd just like to thank our medical advisory group for sharing their expertise tonight. Thank you to Kumi for moderating and facilitating the conversation. And we're all in this together. And I just appreciate how we've all been able to come together to get through it together. So thank you to all of you for your information that you've shared. But thank you to all of us who are joining us tonight and who will watch this in the future. Thank you for tuning in. The information is very important.
Thank you so much, everyone. Have a wonderful evening. Bye-bye.
Thank you.